Hey guys, my name's Rachel. I'm on the Haru tonight. How you going?
Good, thanks, Rach. My name's Ben. This is Dan.
Yeah.
Got a young 20-year-old male here. Not sure of his name. Haven't found any family members.
Yeah.
He's had a KO from a one-hit punch, as well as a secondary hit on his head onto the concrete.
Yeah.
GCS 7. That's eyes 1, verbal 2, motor 4.
Yeah.
Numbers at the moment: 165 on 100.
Yeah.
60 normal sinus rhythm.
Yeah.
Temp normal, BSL normal. But our biggest problem at the moment is he's super agitated. We can't do anything for him.
Brilliant. Okay. So how's his stats at the moment? They're good. They're 98. Awesome. All right. Just stay there for a sec.
Sure.
We might get a bystander to hold him down. Would you mind drawing up 5 and 5 of Medaz?
Yeah, sure.
And also 8 milligrams of ondansetron as well.
Yeah.
I'm just going to do a quick primary. So, mate, can you hear you're really agitated, isn't it? Withdrawing. Yeah, so GCS 7. Are you happy with his airway at the moment?
Yeah, it is clear.
Yep, and he's got a good respirate that I can see, and he's got a good radial pulse still.
Rachel, I've got Medaz
Awesome.
5 and 1 express 2017.
Yep, 5 and 1, 2017. Perfect. All right, Ben, I might take over that if that's all right. Just going to do a quick assessment. All right, so pupils. All right, so his left pupil's a bit sluggish. Got a GCS of 7. He's been moving all limbs, which is good. You've got C-spine on, that's perfect. Yeah, I've got access already. Awesome.
Yep,
We've got 18 in the
18.
ACF and 12 lead on. All right. Might do a quick.
So we've got Medaz 5 and 5 here.
Yep, perfect. All right, we might give 2.5 milligrams IV to get him under control. Just gonna have a listen to his chest.
Alright, 2.5 is in, the time is 18:10.
Perfect, thank you. Alright, so he's got good work at breathing, no respiratory distress with clear air entry, and he's got good colour, he's not diaphoretic at all. He's got strong radial pulse and good blood pressure, so I'm happy with perfusion. Alright, have we got on it good head to toe? So you've bandaged up here, was that just a hematoma?
Yeah, just a hematoma there on the left side above the orbit.
Yep, perfect. And I can feel a bit of a hematoma around the back. Have you guys looked at the back when you scooped him?
Yeah, we did. It looked clear to us.
Yep. Perfect. Alright, so Ben, if you wouldn't mind just holding his head, he's still a little bit agitated, but that'll just take effect in a second. Just going to have a good look. Got good rise and fall of his chest, clavicles are good. Happy with his arms, fix that and do. Nice and soft, pelvis feels good, and
On
the
Dan's.
legs.
Yep. 4 and 2.
On Dan's 4 and 2, 2017.
Lovely.
Legs are very good. Alright, thanks Ben.
That's right.
Now, we haven't obviously got any medical history on him, do we? Is it all
No.
unknown allergies and
everyone
things like
keeps
that?
running away. Yeah.
Okay, so the plan is, guys, we're going to have to do an RSI on this patient because he's a TBI and he's very agitated. Once he starts settling, if you wouldn't mind passing me the BVM, we'll get ready for when he becomes a bit more manageable with that Medaz.
Got the 8 on Dan's here.
Perfect, thank you. Alright, we might get another blood pressure off that Medaz as well.
Some high flow. It's got ETCO2 attached as well.
Perfect, thank you. So I'm just going to
Right,
hold
so
this
you
over
hold
for a
some
second. Yeah, that'd be great, thank you.
5 centimetres.
Yes, thank you.
Done.
Alright, so I've got suction under his right shoulder ready. So I'm going to do a quick consult for drugs. I'm thinking a ketamine and fentanyl induction for this patient. He's about 100 kilos, do you think? Yeah.
Yeah.
So, Ben, if you wouldn't mind seeing up my airway stuff now, we've got an
Sure.
RSI checklist in my kit.
Can you get?
Have a look at that, follow that, and then we'll verbalise it all to each other.
Yep.
Dan, if you wouldn't mind starting by drawing up 100 mics of fentanyl for me by 2.
Yeah,
So
sure.
2 lots in 2 10ml syringes, and also just some metaraminol as well, just in case we need it. So the main things we're trying to avoid with this patient is any hypoxia or hypertension, okay?
Yeah.
So I'm just going to consult quickly.
Checklist should be in the kit somewhere, I think.
Found it. Yep.
So you wanted fentanyl 100 in 10?
2 lots of fentanyl
Yep.
and some metaraminol as well.
Okay, sure.
Hi, it's Rachael off the Hurry. How you going? Good, mate. I've got a GCS 7 male patient who's been punched in the head, fell back and KO'd for 2 minutes. GCS 7, blood pressure's 165 on 100, heart rate of 60. Looking at doing an RSI. I'm thinking a ketamine, fentanyl induction with rock uranium. Yeah, you're happy for that? So he's 100 kilos. I'm thinking 100 ketamine, 100 of fentanyl, and 120 of
Fentanyl
rock.
102, 2017.
Yep.
Lovely.
Great. All right,
And
thanks,
the second
mate.
one is
Bye.
fentanyl 102, 2017.
Lovely. Thank you.
All right, Dan.
10 mils syringe.
Yeah.
So if you can add to the drugs that we're going to draw up 100 milligrams of ketamine.
Yep.
and 120 milligrams of rock uranium.
Lovely, thank you.
All right. Now, if I can grab an OP off you, Ben.
Yeah, sure.
I'm going to do another GCS. All right, so at the moment, he's GCS 5 to cortical
Shall I size
posturing.
that?
So we're going to size that up quickly. From the mouth to the tragus, yep. Happy with that. And we might grab some nasal prongs on 15 litres a minute too, if that's all right. So we're just going to do a good 5 minutes of pre-oxygenation, and we'll go through our RSI checklist. We'll make sure we're all happy with what we're doing and what our roles are.
Yep.
Perfect. Now, if that's not staying because of the collar,
yep.
we can put some tape on the cheeks to try and just hold that there. Because obviously this part's the most important.
So just quickly, mate, ketamine,
Yep.
20 milligrams.
Lovely. Can we get two
Oh,
bits
sorry,
of
200 milligrams.
2 bits of tape? Have you got from the other day?
Yeah, sure.
Alright guys, so we've still got a good rest rate at the moment, so I'm just going to pretty much hold the bag here to give 100% oxygen. Thank you. So we're just going to hold that on him. He's becoming a lot more settled now. So what we want to do basically, we want to set up our RSI equipment. So Ben, you're going to be my airway assistant.
Yep.
And Dan, you're going to be on drugs. And once you've pushed the drugs, we're going to take the collar off and we're going to do manual in-line stabilisation for the C-spine, okay?
So far I've got the 200 mics of fentanyl, I've got 200 milligrams of ketamine here, and I've got metaraminol drawn up here.
Yep, perfect.
Have we moved from all just
Yep,
two?
yep.
Okay.
And just be wary with the ketamine that we're only giving 100, so we're only going to give half of that, so
Okay.
10 mils.
Sure. I've got 2.5 mid still there as well.
Perfect.
How much rock uranium did you want?
120 milligrams, please.
Okay,
That should be 12 mils.
sure.
So Ben, I'm going to go in with a size 7 ET. So we want to have a size 6 and a size 8
Yep.
nearby as well. We also want to have a bougie, a laryngoscope, and the blade with it working.
Yep.
The light coming on. We want a tube tie,
Tube tie, yep.
manometer,
And just
10 mil
quickly,
syringe,
Mhm.
rock uranium?
Yep.
200 in 2.
Lovely, 2019.
and we also want an LMA and a naso there as well, and our surgical airway kit as well.
Cool. Just so you know, you've got suction of the right shoulder
Yep.
currently.
Perfect.
Do you mind grabbing that if you can? Lovely.
Now Ben, have you assisted with an RSI before?
I think once, yes.
Yeah,
Yep.
great, okay.
Okay. So I've got the rock uranium,
Yeah.
120 milligrams and 12
Perfect.
mils.
So we're just going to do another 2 minutes pre-oxygenation. I want to make sure this is really good. Can we get another set of obs as well, please?
Yeah, sure.
And if you've got time, Dan, do you mind just popping another cannula in the other arm as well?
Sure. No worries.
Alright, so at this stage, I'm happy that he's an isolated TBI. Our plan is to get the RSI done. Now, if we are unsuccessful in the first attempt, we're going to pre-oxygenate again,
Mhm.
get those sets up, get that oxygen reserve up,
Mhm.
and we'll have a second attempt. At any time if that fails, we will revert to an LMA.
Yep.
But we have got our surgical airway kit there
Yep,
if we
right here.
require it.
Yep.
So we're all briefed on the failed intubation drill. And if we do fail, we'll be awaiting for those drugs to wear off.
Sodium chloride.
Lovely. Yep.
Perfect. So get one more cannula in. So Ben, if I can get you to read out that RSI checklist
Sure.
for me.
You're happy with the indication as neuroprotection?
Yes.
For head injury? Yep,
Yeah.
lovely. Pre-oxygenation,
Yeah.
BVM with PEEP, 5 centimetres, which you've got. ETCO2,
Yep,
adequately
got that
inflated
and
face mask.
working. Yep.
Oropharyngeal plus minus nasopharyngeal.
Yep. We've got no pin. I'm happy with that.
Lovely. Nasoprongs, high flow,
Mhm.
max 15 litres.
Yep, we're on 15 litres at the moment.
Oxygen source, we've got 2
Yep.
available. In
Brilliant.
fact, we'll require 2. We've got both running at the moment.
Yep.
BGO within normal limits, it
Yep.
was 7.1. The basic neurology assessment.
Yep.
Yep.
Happy with
ECG, non-invasive blood pressure,
Yep.
SpO2, and ETCO2.
Yep.
We've got IV access.
Yep.
Did you want to back up
Got
access?
bilateral, so we've got
Your
bilateral 18 gauge access.
Lovely.
We've got fluids TKVO through the right ACF at the moment.
Yep. Have we run those, Dan? To give
Yeah, they're running.
Excellent.
This is flushed fine. That's in okay.
Thank you.
Lovely. We've got suction
Yep.
as well as a second unit if required.
Yeah.
Now the equipment check I've got over here, we've got 2 laryngoscopes,
Yep.
both working, 2 ETTs, as well as spare ETT, both you've
Yep.
seen me check the cuffs. We've got 2 bougies available.
Yep.
I've got a 10 ml syringe prepped, tube ties underneath the patient.
Yep.
We've got 2 LMA sizes available.
Yep.
We've got a surgical airway just in case available.
Yep.
And I've got a working manometer here.
Great.
Patient position.
Yep. This is the best we can do.
Yes.
But at this height is the best for me with my intubation and my laryngoscope.
Yep.
But obviously we can't do any head extension because of C-spine precautions. So.
Did you need one of us to assist with mils?
Yeah. So Dan's going to do that
Cool.
after he pushes the drugs. Yeah.
Excellent. Speaking of drugs, so we've got the induction agents.
Yep.
Yep, so ketamine and fentanyl are both here.
Lovely. We're happy with all the doses.
Yep. So 100 milligrams of ketamine and 100 micrograms of fentanyl.
Lovely.
In that order.
We've got the rocks, sorry.
Yep, 120.
And do you want some metaraminol?
We've got metaraminol drawn up as well. We've
Lovely.
given on Dancitron.
Did you want any adrenaline as well as a backup?
Yeah, we might draw up 100,000 of adrenaline just as a backup. I'm not too concerned his blood pressure's going to change, but
Yep.
we'll have it there as a backup.
And just says brief team prior
Yeah.
to. The only other thing is to have your post drugs available.
Yeah,
as well.
perfect. Alright, so that is the last obs, guys, just so you're aware. Blood pressure's 170 on
Adrenaline,
105.
Yep.
170 on 105, heart
Yep.
rate's still 60. That was just a minute ago.
Yep.
He's still a GCS of 5 at the moment to corticate. So we've done 5 minutes of pre-oxygenation. So what we're going to do, Dan, in a second I'm going to get you to push the drugs. Okay, we're going to verbalise all of that. We've done all our drug checks.
10,000.
Perfect. Ben, I'll get you next to me. Now, rock uranium 60 to 90 seconds onset.
Yep.
So once he goes up neck, I'll start bagging.
Mhm.
And once we lose jaw tone, we'll be going straight in with the bougie.
Yep.
Okay? Once you've given your drugs, if you can take this collar off and maintain mils, that would be great.
Just confirming, Rach, we're going the crook end first?
Yep, we're going quick end first.
Yep.
And then
your
you're going to
size 7
railroad the
tube?
tube over. Yep, size 7 tube.
Yep,
And we're going
okay.
to railroad the tube over the bougie for me, okay?
Yep, lovely.
And then after that, I'm going to commence bagging. You're going to help me do my checks by having an auscultation after
Yep.
you inflate the cuff.
Yep.
And then you'll tie in the tube for me. And then
Yep.
we're also afterwards going to go with an orogastric tube because I don't want him to vomit
Sure.
and aspirate. So we'll do that
Let's go
after.
with ketamine.
Yep, so we're good to go with 100 milligrams of
100
ketamine.
milligrams, so 10 mils.
Yep,
Let's go in now, the time is 1820.
yep,
And 100 micrograms of fentanyl.
yes.
100 mics going in, also at 1820.
Yep. And we've got that blood pressure set to 5-minute lead blood pressures, which is great.
Okay. Now, rock uranium now.
Yes, thank you. 120
120
milligrams.
milligrams rock uranium, also in 1820. Okay.
Alright, so he's already starting to go up neck on that sedation, so we'll just start ventilating. Get mils. We've got all those sats is reading really well, CO2 is reading really well. CO2 is obviously the first thing we're going to check once that tube's in.
Yep.
We want that CO2 to be very good. And we'll keep all of that the same. We'll keep our OP next to us, we use that as a bite block. Alright, we're starting to lose jaw tone. I reckon another few seconds and we'll be ready to go. I'm going to hand you the BBM, Ben.
Sure.
Okay.
Yep.
Alright. So laryngoscope first. Bougie. You can railroad over the bougie first?
Sure. Railroading, I now have the bougie.
Perfect. Watching the black ring markers go through the tube. Of course. Right, you can pull the bougie out.
Pull the bougie.
Yep.
Out.
Perfect. If you can inflate the cuff for me.
Yep. 10 mils going in.
And we're 22 at the lips. If you can connect the BBM for me. I'm going to hold that tube in place. And sats are still good, guys?
So that's perfect, 100%.
Great.
Good around the floor, just there.
Yep,
Collar's
great.
going
So,
back on.
collar's going back on. If we can tie that tube in. And if someone can auscultate for me, that would be great.
Here you go.
Yes.
Sorry,
Good.
everything's on top of that tube tie. Come around the other side.
So, yep.
Good air entry. Good air entry. And good air entry.
Great.
That's good.
Now, Dan, if you can draw up rock uranium, we're going to do 5 milligrams per 0.5 per kilo.
Sure.
Just as post-intubation sedation. I'm not thinking we'll require it yet, but just so we've got it there
So 50
for
milligrams
paralysis.
after?
Yeah, thanks.
Okay, sure. Alright, Rach. So I've got rock uranium 10 in one.
Yep, perfect.
101, sorry.
Happy with that time?
Yeah, I'm happy with that, thank you. And if you could put that bite block in for me.
Block, sure. On your side.
It was just there.
That's right, I can get another one. Might go smaller.
Yeah,
Which side would you like it?
left please. And obs wise, we've still got a blood pressure of 170 on 100 and a heart rate of 60. We might go, we've still got that 5 and 5 of Madaz. We might go another 2.5 milligrams of Madaz just to maintain sedation, and then we're going to use that second lot of fentanyl, 25 mics PRN.
Alright, so
So-
50 of rock here.
Thank you. Just got that drawn up, ready to go.
Alright, so you wanted the remaining 2.5 in the dad in there.
Yeah, thank you.
Manometer's in the green.
Perfect, thank you.
So 2.5
So-
daz and how much fentanyl, sorry?
So we're just going to get the fentanyl ready. We've
Yep,
got it
I've
ready.
got it
So
ready,
we're
yeah.
going to go 25 mics PRN.
Mhm.
So signs of under sedation that we're looking for is any tearing, any sweating, any spike in blood pressure, which is going to be hard for us to assess with his hypertension,
Yep.
but particularly tachycardia because his heart
Okay.
rate shouldn't become tachy.
Okay, sure.
So we've got everything else. Can we go through the post-RSI checklist, thanks?
Yes. Post RSI, appropriate sedation and analgesia, reassess VSS,
Yep. Done that.
ETT cuff pressure has been assessed, consider orogastric, I'm
Yep.
preparing it over here, patient temperature,
Yep, we'll do another temp and BSL.
and hospital notification.
Yeah, perfect. So we've got a warming blanket on him to maintain his temperature. We've got fluids TKVO, which we might keep like that. Happy with our post-intubation sedation. We've got post-intubation paralysis drawn up if we require it. Happy with our tube placement. We're going to do the orogastric. And then I think we'll head off to hospital, guys. We're not too far, about 20 minutes from the Royal. We'll be going code 1. So Ben and I will stay in the back, Dan, you'll be driving code 1. We'll leave my car on scene.
Okay, BSL is 5.7.
Perfect, thank you. So we're trying to ventilate to maintain an SpO2 of 98 to 99% and a CO2 of 35, which is perfect at the moment.
Dan, you got any lube on that side?
Yeah, I'm just got the temperature.
Perfect,
36.7.
thank you.
What did you need,
I
sir?
just some lube if there's
Some airway lube?
Sure.
I think there's some up the top, on the left, up, up.
You got that lube?
Yep. Thank you.
Right. So all our shots and everything are away now.
Great.
Disposed of.
Okay.
Okay, do you need to do anything for you right now?
We might give 25 mics of fentanyl.
Sure.
I really want to keep him sedating.
Okay.
Still remember to give him some analgesia. Ben, if you can take over the bag for me.
Yes. So your tip's lubed. You've got
Thank
50,
you very much.
50
mics
mil
and
syringe,
10
Yep, perfect, thank
50 mil
you.
for aspiration,
Yep,
and a 20 mil.
and have we got our bag as well?
We have our
And
bag.
for the orogastric to
Yes.
connect to? Yep,
So 25 mics are in at 18.26.
thank you.
Bag.
Perfect, thank you. I'll give that to you, Dan. Have you done assisted with an orogastric before?
Yes, I have.
Yep, awesome. Okay, so we're going to measure from the subxiphoid process up to the nose and then to the earlobe. We're at 44. And check the bite block out. So just keep bagging for me, Ben. Just going to feed this one down. Perfect, so that's in.
I'll just aspirate.
Yeah, so aspirate 50 mils of gastric contents for me. Spike block back in.
That's good.
Perfect, thank you.
Anyone on the bag?
Yeah, thanks. Alright, so that's going to be draining. We're going to take that just to his chest there.
Let's put this
I'm
in
going to
clinical waste.
keep that with the tube. Alright, now if I can get one of you guys, we'll pull the stretcher to top height. What the plan is to get in the ambulance. We'll maintain our oxygenation as we have been. We'll go code 1. We've got all of our drugs that we need, and I'll give them a call on the way to let them know what we're coming in with.
Yep.